Well, improving the quality of patient care and our patient safety initiatives are important to everyone who works at the hospital. Starting at the level of the frontline staff and right up to the board, well, we have multiple initiatives throughout the hospital, and each and every day we're asking our staff to think about how they can, in their daily work, improve the quality of patient care and to make the environment safer for our patients and for staff. So we have many different initiatives, but quite frankly, we want to live patient safety each and every day.
Sunnybrook participates in a lot of the Safer Healthcare Now safety initiatives. Currently, I know that we're doing medication reconciliation. We participate in surgical site infection prevention, central line infection prevention. We have a rapid response team here, so many of the initiatives we do participate in. And as the intervention coordinator for venous thromboembolism, I can tell you that certainly, obviously, I'm at the front lines working with frontline staff to try to make sure that we can prevent venous thromboembolism in our hospitalized patients.
In almost all organizations, we think we do better than we really do. And it's only when we start to measure what we actually do that we realize there are gaps in what we should be doing and what we're actually doing. For example, we thought that our prophylaxis for hip fracture patients was perfect. Until we started to measure it, and then we found out that a substantial proportion of hip fracture patients weren't starting DVT prophylaxis in an appropriate time period after their surgery. And so since then, this data has allowed us to recognize this problem and to implement strategies to make sure that that deficit is fixed.
We knew as we were tracking some of our data that we had certain patient populations where our surgical site infections were higher than certainly we wanted and higher than some of our peers. So through our clinical teams, and here we're talking about surgeons, anesthetists, nursing staff, and other professionals, we sat down and decided where we felt the problems were and what strategies we could put in place to make a difference. And at Sunnybrook, we're very fortunate as well in that we have a group of scientists who work with us so that when we're trying to determine whether we're making a difference, they can tell us what the important measures are, and they monitor our progress. So through surgical site infection, we know we've made a difference, but it's because the entire team has worked together to make that difference.
So it's terrific to work in an environment where not only you're supported to do this, but where the overall culture of the institution supports the things that you believe are the right things to do in a hospital.
I feel really fortunate that I have a lot of support from the Director of Quality and Patient Safety here at Sunnybrook, certainly from the CEO at our hospital, from the physicians that are involved in the project, and also all the physicians here and frontline staff who are interested in patient safety. And I think most people probably feel like we did, that we do this really well already. And what I'd like to say is that unless you're measuring what you're actually doing, it's really impossible to know how well we're doing. So I would encourage everybody to at least have a look at the Safer Healthcare Now website, intervention getting started kit, and perhaps doing maybe even a one-day audit in their hospital.
Safer Healthcare Now has taken very much of a lead role across the country. We've been able to take learnings from one organization, share it with others, and have a common voice where across the country people are focusing more attention on quality initiatives and patient safety best practices than they did before. So every organization is going to want to do what they can in future to make their organization as safe as possible. One of the things we can do is to share the information that we have, share some of the quality initiatives that we have in place. If we know that we can make a difference for our patients, that's information that should be in the hands of everyone across the country and, quite frankly, across the world.